Just a quick heads up before we start. I'm going to be talking about medical things, and there's going to be a super squeaky bit later on, but I'll give timestamps if you want to skip over it. A few months ago, I woke up and saw this. I wear glasses, so I took my glasses off to check if there wasn't anything on the lens. Nope, still there. The next thing I did is check if it was something in my eye or in my brain. I closed my left eye. Things were still there. I closed my right eye. Interesting. Closing my right eye causes the colours of the thing to invert. So this was something in my eye. That's a bit concerning. My optometrist had told me that if I saw things like that, I should go directly to the hospital because it might be a detached retina. But I am an idiot and hoped it would get all better on its own. It didn't, but the next day it had not gotten better on its own, so I went to the local hospital. Since we now live in COVID times, in front of the hospital is a large tent where the nurse does pre-triage, separating possible COVID cases from the other people. I waited the recommended 1.5 metres behind the lady in front of me. The lady in front of me was arguing with the very patient nurse that she shouldn't have to wear a mask in the hospital. While I waited 3 metres away from the angry lady, that angry lady explained that she had a fever. I was standing 6 metres away when the woman stormed off. Look, I believe that most people want to get through their workday with minimum of aggro. If I make a person's job easy as possible, in turn they will try to treat me right. Even before I had set out to the hospital, I had already prepared a little mental script of what I was going to say in reply to the most typical questions I would get. So when I reached the nurse, I was friendly and cooperative. She was asking if I was suffering from any sneezing, coughs, fevers, or if I had been international or to any COVID hotspots. I said no to all of these. Then she asked me what my symptoms were. I repeated my prepared script, and she said, sounds like it could be a detached retina, and instructed me to continue to the non-COVID emergency room. Apparently, today's emergency theme was eyes. Along with myself, there was a man who had been hit in the back of the head with a glass bottle and now was having trouble seeing. And there was a house painter who had not used proper personal protective equipment and whose eyes had become irritated because of paint stripper fumes. If the last 2 years have taught us anything, it is that we should use proper PPE. So, I was in the queue for the eye testing equipment, but my turn came around soon enough. On the other side of the emergency room was a standard eye test chart, which I couldn't see. But after the nice lady moved out of the way, I still had trouble seeing it. As I said, I wear glasses. Very powerful glasses. Very powerful glasses whose prescription needed to be upgraded. So even with my good eye, I couldn't read much beyond the first 2 lines. I was then given a pair of opera glasses, but instead of lenses, they had a tiny hole. Eyes are a bit like cameras. If you wish to make a sharper image using a camera, you can adjust the focus using the lenses, or you can tighten the aperture. The same effect happens with eyes. If you look through a small hole, it improves the ability to see. With my left eye, I was able to read the table with relative ease, but with my right eye, the dot was right over the thing I was trying to look at. The next test was an eye pressure test. Ophthalmologists seem to love this test and use it at every opportunity. They also like to tell you, will feel like somebody puffing air into your eyes. Honestly, this does not make me feel comfortable with the device. Who thinks that having air puffed into your eyes is a nice sensation? The next step was to have a look at the back of my eyes. I was given eye drops to dilate my irises and make it easier for the doc to look into my eyes using a little telescope-like device. Remember how I told you I have spectacularly bad eyesight? Well, because of this, the lenses in my eyes are so bad they actually defocus the images of the back of my eyeball. So the little telescope device had to be modified slightly to refocus it to be correct again. This was quite irritating to my doctors, and sort of to me. The local hospital confirmed two things. One, my retina was not detaching, but there was something very, very wrong with my eyes. So they arranged an appointment with the eye emergency department of the regional hospital. First thing next morning, I was told to go home, but head back if it suddenly got worse. I was also told to avoid sharp blows to my head. I honestly can't think of a medical situation where somebody would recommend I take sharp blows to the head. Until then, I had to get home. You know how I said reducing the aperture of a camera makes an image easier to see? My pupils had just been dilated, so the f-stop of my eye had been turned way down. Even with my glasses, I was navigating a world of vague shapes. Thankfully, I was able to taxi home without too much hassle. The next day, I headed to the city. In the eye emergency department, I was given more tests. My eyes were once again dilated. There was one where I looked into a peephole, and the colour of the peephole changed depending on which way I was looking. I was supposed to look right down the barrel of the machine. At that point, the colour turned to green, and there was another test where I looked at blue dots while a red line scanned down my eyes. After many, many tests, the folks told me the problem was a small bleed in my eye. They either told me this was an ocular bleed or an occult bleed. Bit spooky. I was told to come back in a fortnight's time. If the bleeding had not stopped, they were going to inject me with some dye and use that to work out exactly where the bleed was. I would like to say that the most difficult part of this hospital trip was saying what I did for a living. I ended up saying that I was a freelance animator. But the real hard part was getting the eye drops. I am super squeamish about anything near my eyes. I am now thankful for how patient and professional the nursing staff were with me every time I squished and flinched and squeamed and as they were giving me the eye drops. 14 days later, the bleed had stopped. Dot was now clear, but it expanded a little bit. Apparently, the bleeding had stopped, but the veins in the back of my eye had swollen up. Because this was at the centre of my vision, and because it was slowly expanding, there was a real risk that I could lose my vision. So, it was decided that it would have to be treated. The treatment is a bit squicky, so if you suspect this might upset you, I'm going to give you a timestamp to skip over. There is medicine for my problem. However, this medicine would have to be injected. I am not good with needles. This medicine would have to be injected directly into my eyes. I am not good with things going near my eyes. That day, I spent what seemed like an eternity getting prepped, cleaning the space around my eye, getting eye drops to prevent my eye from getting infected, getting drops so the anti-infection stuff wouldn't cause me pain. Then a lot of time laying down and being very squirmy while the nurses tried to distract me like I was a fussy toddler by taking my attention away from what was happening. And while I was apologising for being so damn squirmy, and while the other doctor snuck up behind me, and then the injection happened. I didn't feel a thing. It was a total non-event. It's not even the "you won't feel a thing" statement that people always tell you about. There was no sensation at all. Over the next week, the problem got better. It became smaller and less prominent until it faded away almost totally. After that, there was another follow-up test. Again, my eyes were dilated and scanned. This time, the doctor was very happy and showed me the before and after photos of my eyes, telling me how much they improved. However, my eyes were still dilated, so at this point, I couldn't see a damn thing. I trust him that there was an improvement. My eyesight is now back to normal for me. So, everybody, look after your eyes, and if you see something like what I saw, go to the hospital. I hope this story was interesting and informative. If so, please consider subscribing.